Today, I want to talk to you about insulin. We're going to talk about how to store your insulin, how to give yourself an insulin shot using a traditional syringe, and how to give yourself an insulin shot using an insulin pen. First, let's talk about the storage of insulin. Insulin needs to be stored in the refrigerator. However, when you're ready to use this insulin, you can take it out of the refrigerator, and this insulin is good for 28 days outside of refrigeration. You want to write down on the label when you took it out of refrigeration, because after 28 days, this insulin may not be able to control your blood sugar. It's also important that you never store your insulin in a hot place like a car. Now, let's talk about how to give yourself an insulin shot using a traditional syringe. First, you want to wash your hands with soap and water to minimize the risk of getting an infection. Now, gather your supplies. You're going to need an alcohol wipe, your vial of insulin, and your insulin syringe, as well as a sharps container. If you don't have a sharps container, you can call your health department and ask about getting a free sharps container. Now, unwrap your alcohol wipe and wipe down the top of the vial, as well as the area of your skin that you're going to be injecting yourself. This is a great opportunity to talk about injection sites. Most people use their abdomen or their thigh to inject their insulin. You never want to inject insulin into a place that's red or painful, and you also want to rotate your injection site. And what I mean by rotating your injection site is that you're going to use the same area, let's say the right side of your abdomen, for about a week. Then, after a week, move over to your left side of your abdomen. Now, let's talk about how to give yourself an insulin shot. First, draw up with air into the syringe the amount of insulin that you need to give yourself. Say it's 10 units. Line up the bottom of the plunger with the 10 on the syringe. Now this air, you're going to inject into the air of your insulin vial by inserting the needle into the top of the vial and pushing down on the top of the plunger all of the air. Now, flip the vial upside down with the syringe inside and draw up 10 units of insulin. If there's any large bubbles inside the insulin syringe, you can draw back past the 10 and then push that air back into the vial. Just make sure that you've drawn up 10 units. Now, remove the needle from the vial and you're ready to give yourself your shot. You can use your fingers to plump up a little bit of fat on your abdomen, and at a 90-degree angle, stick the needle straight into your skin. Press down on the plunger of the syringe, and now you've administered yourself insulin. It's pretty simple. Now, let's move on to the insulin pen. First, you want to wash your hands with soap and water and gather your supplies. You'll need an alcohol wipe, your insulin pen, as well as your pen needles. Uncap your insulin pen and use your alcohol wipe to wipe down the top of the insulin pen, as well as the area that you plan on injecting yourself. Then, unwrap the foil from your pen needle. Combine the pen needle with the insulin pen and screw it on. Remember, righty-tighty. Remove the outer cap from the pen needle and set this aside. You're going to need it later. Remove the inner cap of the pen needle and you can throw this away. You don't need this anymore. Using your pen, you want to prime your pen. By doing this, it'll remove any bubbles that may be in your pen. Using the pen needle, click back till you receive the appropriate amount of insulin. Let's say it's 10 units. Now your insulin pen is ready to be injected. Find the spot that you want to inject. Using your thumb and your index finger, plump up a little bit of fat and inject straight into your abdomen. Using your thumb, press down on the top of the insulin pen. Hold this in place for about 6 seconds to make sure that the entire dose has been received, and remove the insulin pen from your skin. Using that outer cap from your pen needle, unscrew the pen needle from the insulin pen. Remember, lefty-loosey. You can throw this pen needle into your sharps container. Recap your insulin pen, and that's all. And that's how you give yourself an insulin injection. Now, I understand this is a lot of information, and so if you have any questions, be sure to talk to your healthcare provider about how to give yourself an insulin injection.